Well, it's no secret that there is a nursing shortage, and so early 22, Carol Burrell asked a group of us to get together and really come up with a strategic plan for how we were going to address staffing in the now, near, and far.
The PCT program was originally created because we needed another avenue to bring in entry-level clinical staff, specifically for the nursing. We always have a shortage of patient care techs on the units and nurses.
The PCT Advancement Program was actually funded by Lona Pope and her husband. They really wanted to create career opportunities for our internal employees that were in jobs other than nursing. So maybe an environmental services worker or a dietary services or someone in maintenance who thought they might want to get into healthcare.
We work with Lanier Tech and North Georgia Tech. They are the ones that are teaching our students. We revitalized the program in 2022, so we had 2 cohorts that year, and this year in 2023, we've grown that to 7 cohorts.
We cover the cost of their school. We provide them with all their supplies and books, anything that the school feels they need to be successful, even down to providing them with scrubs and some good quality shoes. All those things are provided to them at no cost, and that in itself is huge. However, the part that often makes it really appealing to the participants is we also pay them a salary. We pay them an hourly wage while they're going to school, but they only work 1 shift in the hospital per week.
At the end of the program, we offer them a full-time patient care tech position, and we ask that they stay for 2 years. So we're looking for a 2-year commitment to really get us from that now to the near, not quite to the far, but we hope that they'll stay for the far.
I think a common thread among our participants is that they care about people. We've had folks apply to the program from lots of different backgrounds.
I was driving a school bus for 16 years is what I did before this, and was a parapro, but I ended up with a heart condition and I had to have a defibrillator, so you can't have a DOT license anymore. So I found this online where it would pay for you to go to school.
Actually, my job before this scenario, I used to kill bugs. I had my own accident 3 years ago, so once I got out of the hospital and rehab, I kind of was looking something different, and having been stuck in a bed for as long as I was, I understand how they feel.
So I'm still in high school, and my friend applied for this and told me about it because she knew I always wanted to work in healthcare. And so pretty much I would do this, and then at night do school.
Our program was at Lanier Tech campus. We had 3 different courses: medical terminology, introduction to healthcare professions, and nurse aide. It wasn't hard, it's just a lot of studying and practice. We had to practice a lot.
My passion is to help people. It's just like, it's like an instinct. I could be at the grocery store and someone needs help, and it's just like, okay, Simone, you need to take action. So I learned a lot through the program, and then being in PACU, we even learned more because they're coming out of the OR, so I got the extra experience and knowledge, so that was fun. I love it. I really appreciate Northeast Georgia Health System.
I was currently working with health management, which is medical records. I was working from home. When COVID first started, they were urgently needing people to help assist the nurses, and I was like, well, I could do it. They really did help me out because I've never done patient care within the 7 years I've been here. I learned about the program through one of the HR recruiters. She had mentioned it to me, and within an hour or 2, I was in.
So far, we've had a 100% success rate in obtaining that certification at the end of the course. Then we have another patient care tech on our units within our organization, and we're keeping them all right within NGHS.
The program has mean a lot to me in regards to like helping others. I feel like I've learned a lot about helping. I love the feeling of just being able to help anybody, like brighten their day if they're feeling sad or if they're feeling lonely. I like just being there for them.
For the LPN Advancement Program, internal employees or external employees can reach out to a recruiter to get some information about it. And when they are accepted to an LPN program at either Lanier Tech or North Georgia Tech, they come on with us as employees for that full year while they're in their LPN program. Foundation funded as well, so all of their tuition, books, uniforms, Everything is paid for. And then NGHS pays them full-time hours with the expectation that they work 36 hours a pay period as a certified nursing assistant. So that is a prerequisite to get into our program. You must be a CNA already and capable of doing that role, so that gets us some workforce during that 1-year program while they're in school, helps give us a PCT on the floor, and then at the end of their 1 year, we hire them into a full-time LPN position with a 2-year commitment as well.
I applied and did my CNA last spring semester, so this time last year got my CNA. I started the job on June 6th, and when I was training with the job and just looking at it, the little LPN Advancement Program popped up, and I was like, kind of divine intervention to step up. So it's furthering me on my career path that I want to go into.
To be completely honest, it has made going to school and working 10 million times easier. I do not know how people do both without this program. I'm able to do my schoolwork, and school comes first, and the hospital and my unit understands that. They work around my school schedule. I think it was an amazing program for them to consider.
I just want to say thank you for the opportunity. That's all. I love what I do, and I'll be here for a while. I'm not going anywhere.